Hi, this is Dr. Suji Tang. I'm a hematologist and oncologist from Victory Hematology and Oncology in Sherman Oaks, California. I practice hematology and oncology, treat patients with blood disease and cancers after I graduated from University of Southern California in 2012. Today, we are going to talk about breast cancer prevention. Let's first talk about women's breasts. Inside women's breasts are millions of lobules and ducts. Lobules produce milk and drain from the ducts to the nipples. And surrounding the ducts and lobules are stromas. Majority of tumor originate from lobules and ducts. And the second picture is breast lymph vessels and nodes. Lymph provide fluid and food to the breast tissue, and lymph drain from the breast tissue along the lymph vessel to the lymph nodes. If women had breast cancer, the first lymph node metastasis is the axillary lymph node, which is located near the armpit area. Men can also have breast cancer. Breast cancer includes carcinoma in situ and invasive carcinoma. In situ is the earliest type of breast cancer, which means cancer confined in the duct and confined in the lobules. The breast cancer confined in the duct called ductal carcinoma in situ, and the cancer confined in lobules called lobular carcinoma. It is the earliest stage of breast cancer. And then disease can progress into invasive carcinoma, which includes invasive ductal carcinoma and invasive lobular carcinoma. There are other rare types of breast cancer as well. For example, sarcoma in the breast. So what are the risk factors related to breast cancer? First, when people getting older, the chance to have breast cancer are higher. And second is genetic mutations. The most common genetic mutation is BRCA mutation. There are other genetic defects, genetic mutations related to breast cancer as well. The next one are related to hormone exposure. In generally, the longer duration of hormone exposure, the higher chance to have breast cancer. So the following factors could be related to breast cancer, including early menstrual period, late or no pregnancy, start menopause after age 55, using combination hormone supplement after menopause, or taking oral contraceptive medications. All those factors might be related to breast cancer risk. And the next risk factor is not being physically active. Being overweight and obese after menopause. having dense breast. And if the patient already have a history of breast cancer, the chance to have second breast cancer is higher. And if the person had a certain type of non-cancerous breast disease, the chance to have breast cancer is also higher. Family history of breast cancer is a risk factor. And if a person previously received treatment using radiation, and the chance to have breast cancer is also higher. For example, when patient had Hodgkin's lymphoma, if they receive radiation in the mid-sternal area, the chance to develop breast cancer is increasing. Drinking alcohol could increase the chance to have breast cancer. Smoke tobacco could also increase chance of breast cancer. So now we know the risk related to breast cancer. How to prevent breast cancer? First, quit tobacco. Second, quit alcohol. Increase physical activity. Avoid excessive weight gain. Consume healthy diet. Increasing fruit and vegetable could protect you from overall risk of all types of cancers. Decrease glucose load, because insulin and insulin-like growth factor promote cell proliferation. High insulin may cause certain type of cancers. Some studies showed patients with diabetes have a twofold or greater risk of cancer of liver, pancreas, uterus, colon, breast, and bladder. Vitamin could decrease the chance of breast cancer. Folate in the diet has been associated with decreased risk of colon and breast cancer, especially in women who drink alcohol. Next, be cautious if you're using combination hormone therapy or taking oral contraceptive medication. Discuss with your physician if you are going to start on the medication. Next, certain medication could prevent breast cancer, including tamoxifen and relacifene. But every medication has side effects. So discuss with your physician to see if it is necessary for you to take a preventive medication. Next is go do cancer screening test, including mammogram. In generally, when women greater than 40 years old, recommend do annual mammogram. But if you have increased risk of breast cancer, including genetic mutations, or your direct family have breast cancer, then you could do cancer screening at early age. For example, if you have BRCA genetic mutation positive, then you need to do breast self-exam at 20s, and then do imaging for cancer screening at 30s. And if your direct family had breast cancer at 40s, then you need to do breast screening, cancer screening 10 years younger than the diagnosis age, like 30s. Thank you for watching this video. If you have questions, please make comment for questions. Email us at office at victoryoncology.com. Call us at 818-616-3998. Visit our website, victoryoncology.com. Watch live video at Facebook/victoryoncology every Friday between 12 p.m. to 1 p.m. We have live seminars. Thank you again.